Pregnancy is a very beautiful journey and I hope that you are enjoying it very well. But in many cases, we have seen a lot of skin changes which take a toll on our mental health. It is seen according to the studies that more than 90% of the females suffer from skin changes and more than 60% of them suffer from mental depression because of skin changes that are seen during pregnancy. Majorly pigmentation, acne and stretch marks are the common skin conditions that are associated with pregnancy, followed by other skin, hair and nail changes also. So why these changes happen during pregnancy? So during pregnancy, we undergo a lot of hormonal, metabolic and immunological changes. Androgens and a lot of hormones like estrogens, progesterone, beta HCG level increases. These hormones increase melanin synthesis and pigmentation at specific areas at different trimesters. Also, the sweat glands, they become really active and we have seen a lot of acne cases during pregnancy. There are a lot of clinical trials and systematic reviews which are being done to test the safety of topical products being used during pregnancy. आज हम highlight करेंगे different skin changes and the safe skincare products or strategies that you can follow to have a stress-free pregnancy. So let's talk about general skincare pertaining to your skin type. If you are having oily skin, it's better to avoid salicylic acid face wash, which we normally prescribe to the patients with oily skin, because salicylic acid can be absorbed from our skin and is not good for the fetus health. You can opt for benzoyl peroxide containing face wash that's little safer compared to salicylic acid. Moisturizer should be non-cream based and oil free. For all the skin types, not only oily skin, if you are considering to use sunscreen during pregnancy, make sure you prefer physical sunscreen which contains zinc oxide and titanium oxide because it doesn't get absorbed. If you are having dry to combination skin or dull and dehydrated skin, hyaluronic acid serum or hyaluronic acid is go-to product for you. Hyaluronic acid is completely safe during pregnancy. Apart from that, you can use coconut oil and olive oil on your skin. You have to avoid hot water bath or hot water face wash because that further dries your skin. Now this was for normal skin care. If we talk particularly about the particular skin conditions like hyperpigmentation, melasma, so the general instructions for that is opt for the products which contain safer products like arbutin and kojic acid. Better to avoid hydroquinone and other molecules like glycolic acid. Arbutin is a derivative of hydroquinone which is not absorbed from our skin and is safer compared to it. There is other very good product, that is azelaic acid, which is also used for hyperpigmentation. Now azelaic acid can be used safely during pregnancy if you are using it for a smaller area, not the very large area. Now talking about melasma, sunscreen of course is very important, and as I already mentioned, physical sunscreen you should opt for. There are other chemicals in the sunscreen like avobenzone and octinoxate. Now these molecules should be used with caution. Now there are a lot of detan products which are available in the market that contain dihydroacetone. Now dihydroacetone is considered to be safe in pregnancy and doesn't get absorbed. Second most common concern is acne. In acne, normally we prescribe patients retinols, adapalene, benzoyl peroxide and lot of topical antibiotics like clindamycin and erythromycin. Now out of all these, retinols are to be strictly avoided during pregnancy because there are studies and case reports which have shown fetal deformities after the use of topical retinols. So topical retinols may which creams are included are tretinoin and adapalene. Azelaic acid, as I mentioned, is little safe. Benzoyl peroxide, again, if you are using it for a very smaller area, can be considered safe. Clindamycin is controversial and it's preferred to avoid it because it may lead to enteric changes in the fetus. If you are on some anti-aging regimens before your pregnancy was confirmed, you can continue safely with vitamin E and vitamin C molecules in your serums. But yes, stay away from retinol containing anti-aging creams. Now second trimester is the time when the skin changes take in the form of stretch marks and sometimes the stretch marks are very pigmented. So in order to minimize the visibility of stretch marks, hyaluronic acid, vitamin E, molecules like hydroxyprolyserine C and rosehip oil are considered very safe during pregnancy. Do massage the skin with a thick oil and a thick moisturizer very liberally along with hyaluronic acid. Daily moisturizing helps a lot if you are doing it with the help of cocoa butter, almond oil, coconut oil and shea butter. And also do not forget to have your diet rich in vitamins and antioxidants, mainly omega fatty acids. And very importantly, make sure that your diet contains loads of vitamins and antioxidants that will help your skin glow further. So friends, do take care of your skin during your pregnancy and enjoy a glowing and healthy skin. Hope you have a very safe pregnancy, and if you like this video, share it to your friends.